much for joining us to today's webinar, Enhancing Healthcare Interactions to Improve HIV Outcomes in Agricultural Worker Communities. If you have a moment and haven't done so already, please feel free to put your name and your location, your health center in the chat so we know where you're all from. So I'm Rebecca Young. I'm here with a colleague of mine, Laura Nadal, and then also Renee Edwards, who is from Migrant Clinicians Network. We'll all be presenting today. Farm Worker Justice is a national organization that supports migratory and seasonal agricultural workers and their families to improve their living and working conditions, occupational safety, and access to healthcare. Migrant Clinicians Network's mission is to create practical solutions at the intersection of vulnerability, migration, and health. Today, we're going to be covering a number of topics. First, we're starting with our welcome, followed by the objectives. Then we're going to be continuing on to MSOS, Migrant Seasonal and Agricultural Workers, and HIV. Then we'll be talking about improving HIV care. Then we'll move on to the 5 Ps of sexual health and patient-directed care, followed by resources and questions, and then finally the evaluation. Today's webinar objectives are to understand the barriers that may prevent migratory and seasonal agricultural workers from accessing healthcare, to discuss strategies to communicate effectively about sensitive topics with patients, and to outline the 5 Ps of taking a sexual history to ensure effective care.
Awesome. Thanks, Becca. So I'm going to be talking here about migratory and seasonal agricultural workers and HIV. So our first slide is about why these workers are at risk. So they face various economic and health-related needs. They often are frequently relocating due to their work and experience loneliness and isolation due to this. Agricultural worker camps are usually in very rural areas. They have heightened sexual violence and intimate partner violence, and they often lack healthcare access. As well, when they are in healthcare settings, there are often communication limitations. So in the language aspect, they often require translation and interpretation. We encourage the use of simple and clear language when speaking with MSAWs. There can often be misunderstandings, so it's important to ask open-ended questions to understand the patient's beliefs fully and be aware of nonverbal communication differences. MSAWs also often fear or mistrust healthcare systems and providers. So discuss the confidentiality of healthcare interactions with your patients, offer reassurance about care, quality, and privacy, and then always invite questions from them. And so why is it so important to communicate effectively with MSAW patients and also with all of your patients? One of them is to build trust. Trust is key to effective healthcare delivery. And MSAWs also may have unique fears or mistrust towards healthcare due to past experiences. They are, given their frequent relocation, they're having healthcare interactions in various locations. Communicating effectively also helps build understanding. Understanding of values and practices helps create a respectful healthcare environment and leads to better patient-provider relationship and health. So when we improving these HIV outcomes, there's 2 categories, social needs and sexual health, sexual history is one. Approach sexual health topics respectfully and avoid assumptions. These are often very hard topics to discuss. Adapt your questions to be respectful, recognizing norms and taboos or discomfort. And then to also improve HIV outcomes, confidentiality and privacy is important. Emphasize the confidentiality of sexual health discussions, and provide a safe, non-judgmental space for patients to share sensitive information. And so I'll pass it over to my colleague, Renee Edwards.
Okay, finally able to get all the little pieces going here. All right, thanks everyone for joining us today. I just want to take a moment and acknowledge that a lot of our slides today are based off previous work that we have done collaboratively with Jenny Waugh from the HIV and STI program at the Michigan Department of Health and Human Services. Just a little acknowledgement because she could not be here with us today. So I want to get started in, again, thinking about how can we improve HIV care. We really are going to have to ask direct, relevant questions of our patients. We're still going to have to walk through a step-by-step process here today to collect a solid sexual history that will guide you on which patients may benefit from both HIV and sexually transmitted infection testing, which I'll refer to as STI, throughout the following slides. So having an STI is an independent risk factor for HIV, so testing for both is really important to know where someone's at in their sexual health. Next slide. Sexual health screenings are something that we should be doing at least on an annual basis, and perhaps more frequently for patients depending on their circumstances, maybe as often as every 3 to 6 months, again, depending on what you find out from them for their sexual activities. So we really want to be talking about this because things changed since the last time you saw them, or if they're new, there's things you need to know. Maybe they recently got a divorce, they got a new partner, they started using dating apps, or some other change that we won't know if we don't ask. And I want to say right from the start, and I'll say it a couple more times throughout this presentation, don't make assumptions that if someone is married, or if their partner doesn't have any other partners, that they're perfectly fine and don't need any of these kind of services, right? A large portion of people that go to STI clinics are married, and a lot of sex workers will report that their clients are married as well. So people may have no idea what their partner's doing, because partners don't often share these kind of things, right? So making sure that you're really getting into information with your patients and keeping in mind that they may not know what their partners are doing. So, few people who may be at increased risk for exposure to HIV include men who have unprotected sex with men, people who have condomless sex with multiple partners, people who have sex with anonymous partners or partners that they don't know their HIV status because people don't always just come out and announce it, and patients who have recently been diagnosed, treated, or had symptoms of a sexually transmitted infection. Next slide. So the health screening really should be for a whole variety of people. And again, these really involve some complicated conversations. So other high-risk patients that you might see in your clinic could be someone who injects drugs or shares injection drug equipment. And again, you really have to be prepared to have this conversation. You have to be asking the question. This is not something people often just come out and announce because they're afraid of being rejected or having negative consequences, right? We want to find out if anyone is exchanging sex for drugs, money, or other resources like housing. Partners of people who live with HIV and partners of people who fit into any of those categories are at increased risk for HIV. Next slide. So doing the sexual health screening, we want to obtain an accurate and detailed history. And that's essential for knowing which sexually transmitted infections, if or when you should be testing for them, right? We want patients to know that they're not being picked on, they're not being called out for some reason. And we want to make sure that everyone understands that this is something that clinicians talk about in a normal way with all their patients. And this is part of providing the best care for everyone based on their specific circumstances. So on the screen, you can see a couple examples of things that you can say to your patients, maybe introduce the idea as I'd like to ask you a few questions about your sexual history. I ask all my patients these questions, and they're important to understand your health. That way I can provide you with the best care, right? A few simple things you can say again to make them not feel picked on. Next slide. And, for some of you, this is going to be uncomfortable. If you haven't done it before, if you haven't had previous training, you haven't had previous practice. So take a deep breath, relax. It will be okay. Take a moment with your patient, introduce yourself, tell them what your role is, and again, why you're going to be asking them these questions. Really think about the language that you're using, your tone, your facial expressions, and anything that they might perceive as being judgmental or unfriendly versus being welcoming and affirming, right? That will help them open up to you. And, it might be a good idea, again, to have some practice before you try it the first time if you haven't done it before. Maybe with other staff, maybe with a friend, maybe even with your own partner to open up some conversation, and just saying the words out loud, it can really help you then once you start with patients. All right. So again, your attentiveness, your tone, think about your body language. Do you look relaxed? And are you keeping a straight face when they tell you something maybe that you've never heard before? Be prepared because those things will happen, right? The more comfortable you are, the more comfortable they will be. Next slide. So we're going to cover the 5 Ps of sexual health. This is one framework for working through collecting a sexual history. When CDC and other organizations started to focus on collecting sexual histories, they started with these 5 key areas to discuss. Over time, a few more important topics came up in addition to the original 5. And in Spanish, the words don't happen to start with Ps necessarily, so they won't be referred to as the 5 Ps in Spanish, but we are talking about the same thing. Next slide. So first, let's think about partners. You want to ask your patients, who do you have sex with? Men, women, both, something else? How many sexual partners have you had in the past 6 months? Do you know whether your partner has other sexual partners? Do you typically know your partners, or are they anonymous? Many people use dating apps nowadays, and some of them, particular things like Grindr, and others that are designed for the men who have sex with men population, have ways of just doing a geolocation kind of thing. So they can have their location available to people around them and let them know that they're available for a hookup. So people can meet people that they know nothing about, do what they're going to do, and go their separate ways. And then next thing you know, they have symptoms. They have no way to reach that person again, right? This is a thing. Obviously, everyone doesn't do this, but people definitely do it. So keep that in the back of your mind when you ask them if they're using apps or not. And then ask them, could you tell me about your current relationships? Do you feel safe in your current relationships? Do you feel safe at home? And have you had any unwanted sexual contact? So, be prepared. These could be hard answers you may be getting from your patients with these. So really think about, do you have resources available to help them if they are unsafe, or if they've had unwanted sexual contact, whether it's an assault or some other kind of forced situation, right? How do they handle that? How can they get out of it in the future? How can they be well now? Next slide. We want to know about their practices. What type of sex do you have? Specifically, do you have anal sex? Do you have vaginal sex? Do you have oral sex? Are you the receptive or bottom partner? Are you the insertive or top partner? And these are terms that are commonly used with men who have sex with men. Being receptive puts you at a little bit increased risk for exposure to HIV. And being insertive gives you a little bit less. You still have risk, of course, but it's slightly less. So knowing what your patients are doing, and sometimes they do both, right? They may do both things. So asking them will help you understand what exactly they're doing. Okay, have you ever been drunk or high when you're having sex, right? When people are drunk or high, they sometimes make decisions that they wouldn't otherwise make if they were sober. And so that can increase their risk as well. Or do you have partners who have ever injected drugs, right? That puts that person at increased risk. And have you ever exchanged sex for food, drugs, money, or housing? This is often referred to as survival sex. It's a common scenario for kids who are kicked out of their parents' home because their parents don't like who they are. And that puts them at very high risk for selling sex just to be able to survive. They may get picked up for trafficking as well, because they're easy on the street. And this is not just for kids. This is in particular a danger that I've seen with kids working in health department, STI clinics. But also, again, this can happen to any adults. When someone is out on the street selling sex for different things is the fastest and easiest way to get them the basic things to survive their day. So if someone happens to have done that in the past or is doing it now, be prepared to provide them with a whole lot of different supports and services in addition to testing so that you can see how they are doing. Next slide. Past history of STIs. You want to ask them, have they ever been tested in the past for sexually transmitted infections or for HIV? How long ago was it? Do they know what the result was? What kind of testing did they get? Was it a swab? Did they collect some urine? Did they get a blood draw or maybe a finger poke? This will help you sort of know what may have been provided. Some providers, some clinicians will only do things like a swab or a urine test for chlamydia and gonorrhea and then not do a blood for syphilis and HIV or the other way around, right? So the person may have not had the whole complete package. And that's a good reason why you might want to do that if they've never had any testing before or if they didn't have a complete package of testing. Ask them if they ever had symptoms. Did they ever have some unusual discharge? Did they ever have pain during sex or when using the bathroom? And while those are common symptoms that are associated with STIs, most people who 50% or more, depending on which condition it is, have absolutely no symptoms whatsoever, and which is why we have a ton of people with STIs. They don't even know and they're passing it around, right? So those are common symptoms that can happen, but keep in mind if no one had any symptoms, they still might have had an STI or could have one right now. You want to ask them, have they been diagnosed, actually diagnosed in the past? When did you have it? On which body part was the infection? And when were your partners tested and treated? It's not unusual for someone to get diagnosed and treated and then go back to their partner who never went in for treatment and get reinfected, right? So important to know whether they've even had those kind of conversations with a partner. And I just want to reiterate the importance, I guess, or state the importance also of testing any body parts that people are using. You've asked them if they have anal, vaginal, oral. Testing all the parts that they use is important. You may test their genitals and they don't have an infection there. A large part of diagnoses are missed when we only test the genitals. So again, if the person reports that they've used all, other parts of their body, and again, don't assume that women don't have anal sex. We see in surveys that many, many more women do now, and it's assumed that that's a result of pornography, compared to, say, 20 years ago when they asked women what they were doing, right? So you should also ask women that question and make sure that you're prepared to help them if they're also having that kind of sex. All right, next slide. We want to know what kind of protection they're using if they're using any. So ask them, what are they doing to protect themselves from STIs? Do they use condoms? Never? Sometimes? Always? If they don't use them all the time, what's the circumstances? It's not unusual for people to have a long-term partner that they do not use condoms with, but then they might, if they have people in the background that they meet or that are random, that they will use condom with to protect their regular partner. So asking them how and when they use them, or it could be again that if they drink or get high, that they sometimes forget to use them, even if that was their intention in those moments, right? So how can we help them better develop those skills of using condoms more frequently or just understanding their risks when they don't use them all the time? You can ask them if they've ever heard of PrEP, HIV pre-exposure prophylaxis, and PEP, post-exposure prophylaxis to prevent HIV. So I just want to ask right now, if you guys don't mind, to put in the chat if you know that your clinic offers PrEP or PEP. Very few of you, I think, will offer PEP. That's a little bit more of a tricky one. But I'd love to see in the chat if your clinic offers PrEP for folks who may be at risk for HIV. I see some yeses. That makes me very happy. Okay, and if your clinic doesn't, it's something to talk to, whoever writes your medical orders and see if this is something that's possible. There's a variety of options now for PrEP, besides just taking pills every day. That can be complicated for people who can't get to a clinic regularly. There's shots and things that can be used that last for like 6 months or so. So think about it, talk to your folks. If you don't, love to see more people doing it. It's a very simple prescription to give. And if you don't, if you do, make sure that you have someone who's able to help with some navigation. Sometimes folks need help with insurance. They might just need help with some of the other options that pharmaceutical companies provide to help people be able to afford getting PrEP. And then ask your patients too, hey, have they been vaccinated for HPV? Uh, I think most younger people will have had it, but now they've really expanded the age range of who can get an HPV vaccine. And so there's older folks who have different things going on. And just a reminder too, seniors do have sex, so don't count them out either when you're having these conversations, okay? But back to the HPV, most people that have had unprotected sex with more than one person in their life has had some kind of HPV, believe it or not, right? There's more than 150 types, most of which don't even cause visible lesions in the skin. So the vaccine prevents against cervical cancer, right? The couple kinds that cause cervical cancer. It doesn't prevent warts. It doesn't prevent the other HPVs that don't really have any obvious symptoms, right? But lots of people carry it and have no idea because nothing's obviously happening. But, we can prevent all that with the vaccine. Next slide. Pregnancy. Do you or your partner have current plans to become pregnant? Are you currently doing anything to prevent pregnancy if that's not what you want? And how important is it to you to prevent it if you don't want to become pregnant right now? So you can offer them options for different kinds of birth control. You can ask them, it might even be the opposite. They're trying to get pregnant, but it's not working out, right? So do you have a fertility clinic in your area that they could be referred to? How far away is it? Different things that you may need to offer depending on what their answer is. Next slide. And I mentioned that there's a few other P's that we believe are important now for you to consider when you're having these conversations. One is pleasure. Are you currently satisfied with your sex life? Are you able to have a pleasurable experience, right? Is it enjoyable for you? And if not, let's try to understand what's happening. Why not? Are you having pain, which might be an indication of an infection or some other problem that we should try to figure out and take care of? Is it a lack of arousal? There's all kinds of medicines for men who might be having arousal problems, and there's a few things that might help women too. If they're premenopausal like me, it might be that they could benefit from some hormones that might also help other symptoms that they're having. Might be that helping them get comfortable with going to the store and buying some lube as an option to help them. It just really depends specifically what is happening with them. Sometimes you can have those available. There are health departments as well that may provide things like lube and condoms. So just going back to that, always think about your health department. Sometimes they will offer them for free to other clinics. So always check in and see if you can't get some of those. But going back to the other P's. So problems again, what kind of problems someone might be having and how might we help them address those problems? And permission. Do you feel pressured or threatened to have sex in your relationships? If that's the case, again, you may be entering into some difficult conversation with your patients and how to help them be safe and either get out of or manage situations where they're being pressured to do something that they may not want to do. Next slide. All right, so a few other recommendations for you to be thinking about as you're going through all this and as you prepare to have these conversations. Focusing on any sexual health goal setting for them to be healthy and safe, right? What is it that they're really going for? How do they want things to be, and how can we help them get to where they want to be and being safe and healthy when their sexual relationships? Explain that HIV and STI prevention strategies can include a whole bunch of different methods. So it might be consistent condom use, or again, perhaps using condoms if they're having relationships with people that they don't know or don't know well. Reducing the number of partners for someone who may have a large number of partners. Might be mutual monogamy. That's a way that they can talk with their partner and agree that they're only going to have sex with each other and no one else during the time that they're together. The fail proof is not having any sex of any type whatsoever or abstaining, right? That was a hot topic back a while ago, and I think it might be returning. So that may work for some people. Most people I talk to, that is not an easy way to manage their sexual health. But for some people, it may work. Using PrEP, right? If the main thing they're concerned about is not getting HIV, or if they are having more than one partner in recent times, using PrEP might be the way to go. And it's just as good for women as it is for men, although there's different options that are better for women. All the options work well for men. And then we mentioned using condoms, and I just want to specify that there are internal condoms in addition to the usual external condoms that we're used to seeing that unrolls onto a penis. The internal condom, which are much harder to come by and are much more expensive, can be completely controlled by someone who wants to use it for vaginal or anal sex. They can be inserted ahead of time, and they are completely controlled by the person then who's the receptive person. And then getting some lubricant even as well, right? That's a great way to prevent tears and keep things to be smooth flowing and not rough and difficult. All right, so we want to encourage ongoing testing. Again, now you've had this conversation and just helping to encourage them to come back if they need to, give them positive feedback for any of the things that they're agreeing to try to use as a preventive method and to keep themselves healthy. Next slide. Some terminology to think about when you're having the conversations. Only ask questions that are medically necessary, right? If someone may come in and you're curious something about them, maybe the way they're dressed, the way they look, their style, their mannerisms, stick to the things that we need to talk about, unless they're actively talking about that as part of their care that they're needing, then, we need to just stick with the topic at hand. Avoid asking questions that imply opinions about what is right or wrong, right? What everyone thinks is right or wrong is going to be different from me to you, to your grandma, to the lady down the street, right? Everyone is going to have different opinions, and these are generally strongly held opinions. So let's keep that they are opinions. We have ours, people have theirs. The main thing is getting people to care for what they need based on their current circumstances, not any ideas we have about right or wrong. So, and don't assume any kind of promiscuity with anyone based on their preferences, their look, their style. Don't make assumptions. At the same time, right, don't imply there's no need for this conversation or test for someone who reports being straight or reports being married or having only had one sexual partner. It may not be true, and we have no idea what their partner does. So, reflect and use the patient's own terms whenever possible. Someone might refer to their breast as a chest. They might say front hole instead of vagina. If we stick with the words that they're using, that will help them be comfortable. And it might be odd at first because as clinicians, we've been trained to always use the standard terms of penis and vagina and all that. But really thinking about your patient and their level of comfort and the way they're talking about themselves will help keep that relationship between you and them, that rapport, and their comfort in talking about more detailed information, and to help them be honest and comfortable with you. And that's what we want them to do. So on the same line, avoid any kind of medical jargon, right? It's always better to just try to use the most basic words you can to talk about healthcare issues, provide clarity. If you realized you said something that might be kind of complicated, just take a moment to re-explain and make sure that they've got it. And then use inclusive diagrams or images. You can buy plastic models and things where you can see the whole body part and talk about it neutrally in an image or in a plastic model. And some of the plastic models there's like a clear outside and you can see the inside. This is really important for women because we often can't see the majority of our reproductive parts because they're on the inside. And so it really helps to be able to have some of those complicated explanations of what might be happening inside if someone can take a look at a model and not have to think about their own personal body. Next slide. In practice, you want to consider the context of each patient's life. Meet people where they're at without judgment. You want to develop care plans and perform exams that are relevant and specific to them. Your interview, your conversation should be done in a collaborative manner that's really centered on them and their needs. You want to keep an open mind and really continue learning new parts of your patient's lives by having these conversations with them. You want to make a conscious effort to stay up to date with terminology and address any ways your own opinions might affect your interaction. So think again about things that might make you uncomfortable and be prepared to try to keep that straight face and just keep focused on providing the health care. Next slide. I want you all to take a moment, before you get started on this and reflect. Am I offering everyone the same level of care, the same kind of tests and treatments that might be the most relevant to them? What assumptions might I make about patients and how can I address those beforehand? What are the history and traditions and values, family systems, and communication patterns for the community that I'm serving? They might be different than my own, and they may affect the way they understand things. They may affect their comfort in discussing complicated things like sexual practices and relationships. This just may not be a regular part of their life. And so it may take a time or two, three to help them really be comfortable opening up with you, right? We don't all hold the same beliefs and values, and being aware of and respecting differences without making assumptions will really build that relationship and help them open up to you. So how might these beliefs and practices influence somebody's help-seeking behavior, their perception of health, their perception of illness, their value for different kinds of treatments, and what does a disability mean to them? What does death and dying mean for them? And it could be their beliefs and understandings of these things could be very different from our own. So really being open to understanding where they're coming from, coming at these kind of conversations with curiosity to ask questions and learn more so that you can, again, provide them the best care possible. And then thinking about how can I create an environment that makes my patients want to come back to see me, right? We want them to keep coming back. The more continuous they have care with us and have a healthcare home, the better off they will be in the end. Next slide. All right. So we're just going to give a little bit of information if you have to do a physical exam with someone, some things to think about before, during, and after the exam to help your patient feel as comfortable as possible, right? So before you start any kind of physical exam, you want to stay in line of sight of the patient. Don't be like back in the corner at the computer if that's the way your office happens to be set up. You want to keep an appropriate physical distance, close enough to easily talk comfortably, but not right up in their face, right? Which I'm sure most of you are well aware of that. Avoid unnecessary touching and just do your best to establish rapport before you ever get to the physical exam. And then ask them how you can support them throughout the visit. You can offer a support person. So if they have another adult that's present with them, maybe they want that person to come in. Or I think what I see very often is that maybe a medical assistant or another nurse in the office might come in for the physical exam so that there's another person there to help everyone feel safe. You want to discuss the process of the exam so they know what's going to happen beforehand. And if they're looking distressed or worried, just take a moment, pause, ask them what they're worried about, and hopefully you can address any concerns before you ever get started. Next slide. During the physical exam, you want to describe each step as you go. Ask questions to gain permission, and when possible, allow the patient to be in control. So some clinics are set up for patients to do self-collection of swabs, and all that. And studies have shown that patients are perfectly capable of doing a good job at getting a good swab. So if you're in a position to allow them to do that, from working in STI clinics, patients often appreciate that option. Not everyone is set up for that. And so, of course, you'll do the standard method, but throwing that out there as an idea as well, that could be helpful to make your patients comfortable. Be mindful of any potentially offensive words or phrasing. Again, these are things like that sometimes get built into our heads, and you have to be conscious of them and try to like move them out, and be as neutral as possible. And here again, we want to be on the lookout for any discomfort or distress that a patient may be feeling and check in with them if necessary before you keep going. Next slide. Okay, so you've done the physical exam. Now what you want to do is just give the patient a minute to get dressed before you do anything else. So go ahead, let them know, take the time, get dressed, step out, When you come back in, that's when you can discuss anything to recap what happened in the visit or things you want to make sure they know, give them the chance to ask any questions that they might have. Make an action plan with them, right? And share the timeline for follow-up. So is your clinic going to call them and tell them the results? Do they need to call the clinic? If so, make sure they have the phone numbers and information, how to contact if they have questions or they need any other kind of follow-up, because it can be complicated. Particularly if there's any language issues, you want to make sure that they understand that the front desk can help them still. Um, and then, have any referrals or resources, you could have gathered that while, they were getting dressed so that you can give that to them right away. And this is a great opportunity to consider the teach back method if you don't already use it. You can ask them to tell you what they need to do after they leave or what happens next or how they need to take their medicine, whatever it is that you think is the most critical 2 or 3 things that they're walking away with. Ask them to tell you what they have to do, and that way you can see, did they fully get it, or do you need to re-explain something or offer some other materials so that they have the complete information once they walk out of the clinic. Next slide. All right, we're on the key takeaways, and I will go ahead and hand this back over to Rebecca.
Thank you so much, Renee. That was such an informative and really interesting presentation, and I learned a lot. I'm sure many of you out there did as well, so thank you. So some important takeaways. MSAs are at increased risk for HIV and AIDS. Another takeaway is that improved access to healthcare, education, and interventions are critical to reduce the burden of HIV/AIDS. Effective intervention should address social needs and to integrate opt-out HIV testing into routine healthcare. Oops. And then effective communication and sensitivity to social needs are crucial to build trust. The 5 Ps framework ensures comprehensive, high-quality sexual health care, and being respectful and non-judgmental improves patient-provider relationships and health outcomes.
Awesome. Thanks, Becca. We want to invite everybody. We'll be dropping in some resources in the chat for everybody, and we want to invite all of you to also share any resources that your health centers or your departments of health have that you find useful in this topic.